IBEX Innovations are a UK-based technology business focused entirely on developing advanced software for medical X-ray imaging. IBEX has a vision to transform bone health through the early detection and treatment of osteoporosis. And the way we're going to do this is by upgrading standard X-ray systems to be able to provide a measure of a patient's bone health at the time when they may present for a fracture.
The cost of osteoporosis is around about 37 billion euros per year across the whole of the EU. Most of this money is actually spent on treatment of fractures rather than the prevention of osteoporosis prior to a fracture. The reason for this is that the diagnosis levels for osteoporosis are just so low. So what Trueview can offer is a much earlier ability to diagnose osteoporosis and therefore treat the disease with very low cost pharmacological prevention methods. IBEX Trueview is a piece of software which integrates onto a DR system. It requires no change to the clinical workflow, and what we do is using this software we can actually gather more information from the standard X-ray image. This allows us to return a measure of the aerial bone mineral density of the patient. We've shown that this correlates incredibly well to a standard DEXA measurement, meaning that you can actually get bone health indication at a much earlier stage in the care pathway. We've recently completed a clinical trial with James Cook University Hospital in the northeast, where we measured some patients on both DEXA and Trueview, and we were able to show that Trueview had a 0.91 sensitivity and 0.97 specificity to osteoporosis. This is a completely unique approach, so the fact that it integrates into current workflow means that you don't need to send a patient off for a secondary scan on something like, let's say, a quantitative ultrasound or DEXA. So it can be integrated seamlessly into a standard radiographer's workflow.
Where we see the real power of IBEX Trueview in the future is in the area of opportunistic screening. So we estimate that around 40% of X-rays that are taken would be compatible with IBEX Trueview, whether that's for a fracture or for another investigation. What this means is that any patient referring for an X-ray could have a measure of bone health returned from that scan. Our health economics modelling predicts that in the UK alone this could lead to 54,000 fewer fractures per year, dramatically improving the quality of life for patients who may be at risk of developing osteoporosis and fragility fractures in the future. Perhaps the biggest impact of opportunistic screening though is on quality of life. Hip fractures are hugely debilitating, and in one survey 4 out of 5 women said they'd rather die than suffer the consequences of the immobility that a hip fracture leads to. We predict that the adoption of IBEX Trueview for opportunistic screening would actually lead to a reduction in fractures of around about 680,000 per year in the EU, UK and US. So you can see that this relatively simple upgrade of DR systems could have a massive impact on the quality of life of patients affected by osteoporosis. We believe that by adding opportunistic screening to standard X-rays that patients will have with a fracture, we can really address the £50 billion plus cost of osteoporosis in the world today. This has potentially huge positive impact in terms of healthcare provider costs, but most significantly on the quality of life for patients by reducing debilitating hip fractures in later life and reducing the chance of mortality from a hip fracture.